Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A patient presents to physical therapy with a Dexa scan result showing a T-score of -2.8 at the lumbar spine. Which classification would be most appropriate for this patient based on the T-score? Option 1, normal bone density. Option 2, osteopenia. Option 3, osteoporosis. Option 4, osteomalacia. Bone mineral density is commonly measured using dual-energy X-ray absorptiometry, or Dexa, which generates a T-score comparing the patient's bone density to that of a healthy young adult. The World Health Organization has established standardized T-score thresholds that allow clinicians to classify bone density and guide treatment decisions. Physical therapists must be able to interpret these values in order to appropriately modify interventions and assess fracture risk. Before we look at the options, let's make sure we have the World Health Organization T-score classification system clearly in mind, because this question is essentially asking you to apply a straightforward numerical threshold. The T-score scale works like this. The more negative the number, the greater the bone loss. A score of -2.8 is a specific data point, and your job is to know exactly where it falls on that scale. Let's explore each of the options. Option 1, normal bone density. A T-score above -1.0 is classified as normal bone density. A score of -2.8 falls well below this threshold, indicating significant bone loss that warrants clinical attention and intervention. This option can be eliminated immediately. Normal bone density requires a T-score above -1.0, and our patient's score of -2.8 is nearly 2 full points below that cutoff. Option 2, osteopenia. Osteopenia is diagnosed when the T-score falls between -1.0 and -2.5, indicating below normal bone density that has not yet reached the threshold to be classified as osteoporosis. This is the most tempting distractor. Osteopenia is in the right neighborhood. It represents bone loss, it's on the same spectrum, and it's a real clinical diagnosis. But the critical detail here is the boundary. Osteopenia ends at -2.5. Our patient's score is -2.8, which is beyond that boundary. Option 3, osteoporosis. A T-score at or below -2.5 meets the World Health Organization diagnostic criteria for osteoporosis. A score of -2.8 confirms this diagnosis and should directly inform the therapist's exercise selection, fall risk assessment, and patient education. The threshold is clear. At or below -2.5 means osteoporosis, and -2.8 meets that criterion. A diagnosis of osteoporosis should immediately trigger specific considerations in your plan of care. Option 4, osteomalacia. Osteomalacia is a distinct metabolic bone disease caused by defective bone mineralization. Unlike osteoporosis, it is not classified using T-scores and presents with different clinical and histological features. When we look at all 4 options together, 3 of them either fall outside the correct T-score range or describe an entirely different condition. Only option 3 correctly applies the World Health Organization threshold to the given value of negative 2.8. The correct answer is option 3. Let's explore the all-student data. 71% of students selected option 3, osteoporosis, the correct response. 25% of students selected option 2, osteopenia. 2% of students selected option 1, normal bone density. 2% of students selected option 4, osteomalacia. This question is an other systems question which represents approximately 18% of all exam items. This question is a Foundations for Evaluation, Differential Diagnosis, and Prognosis question which represents approximately 10% of all exam items. This question is a Level 1 question since the question requires students to possess basic, foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Looking to review related academic content? Check out page 534 in PT Exam, the Complete Study Guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.